sensation. They're used for pain relief. The major cause of death is respiratory depression upon overdose. They cause nausea, but they can be used to treat cough and diarrhea. So why do we, if we want to really get a big kick from an opioid, why would the best way to do that be to inject heroin? Well, you can see that this is the chemical structure of morphine, and this is the chemical structure of heroin. Heroin is almost identical. It's got these two chemical groups covering up these two hydroxyl groups. That's the difference between morphine and heroin. Heroin doesn't do anything to the body, or it doesn't do anything, doesn't really do anything to the body. So why do we bother? Why do we take it? Well, if we inject heroin, first of all, we get a lot of it into the bloodstream very quickly. These groups on morphine make it a little more water soluble, and that makes morphine a little slower to get into the brain. If you have fatty substance, it really gets into the brain quickly. If you have a more water soluble substance, it gets into the brain slower or not at all. So what heroin has, it's covered up these water soluble groups, and it's made itself less water soluble and more fat soluble. And that means heroin will get into the brain a lot faster than morphine. And once it's there, conveniently, there's metabolic enzymes that take these groups back off, and then all of a sudden you have morphine. But you have a whole lot more of it in the brain, a whole lot faster than you did if you just ingested morphine or even injected morphine. So that's one of the reasons that heroin is used by injection instead of morphine. What about OxyContin? This has been in the news a lot. Lately, OxyContin contains oxycodone, which is a synthetic opioid. So it's not a natural opioid like morphine. It's a synthetic opioid. But it basically does the same thing. So why is OxyContin a sort of drug of choice compared to other opioids? Well, one of the things that we need to develop for chronic pain is long-lasting drugs. So we don't want to have to take something every 6 hours. If we could take something once a day, that would be great. So OxyContin was manufactured as a time-release capsules or tablets. So you take it into the body, and it's going to slowly release oxycodone throughout the day. And so you can take it once and really sort of have a fairly stable level of oxycodone in the body. So it goes from 10 milligrams to 160 milligrams of, those are the doses that you have. But it turns out if you crush up the tablet, you break down the way it's processed, and that gives you, instead of 160 milligrams released over 12 hours, you get 160 milligrams released all at once. So that's why it's used for recreational purposes in addition to its use for chronic pain. And the manufacturers are now trying to come up with a different formulation that will remain intact even if the tablet is crushed. So you can still use it for the long-acting purpose without having other people use it for the short-acting.
It's because if you crush it up, you increase the surface area and then you
Yeah, so they're formulated in these little kind of bubbles that break down slowly, these little sort of matrices, but you can disrupt them and cause just the whole release. So if you can formulate maybe smaller microparticles, you might be able to still crush it into a powder but have that remain intact. And Percocet is another, this is oxycodone as well. This is in combination with acetaminophen. And many opioids are sold in combination with acetaminophen, and that's to discourage using a lot at a time. And actually, if you took a whole bottle of Percocet, you probably wouldn't die from oxycodone. You'd die from your liver shutting down, because acetaminophen in large doses can cause extensive liver toxicity. Yeah.
That seems like a bad way to prevent abuse, because I don't think people really think about it. Would they? Would they go and look is the acetaminophen going to kill me before the?
Yeah. Well, I mean, I think certainly an experienced user would eventually learn that, and may learn that from actually doing it. But that is one of the reasons that that's put in there as a deterrent. And it's also a pain reliever as well, so you can get folks. So what does the withdrawal symptom for morphine look like? It's terrible, and that's why if you're dependent on morphine or another opioid and you go into withdrawal, you have a very high motivation to make that withdrawal syndrome stop. So everything starts to water, your eyes and your nose, you can't stop yawning, you have difficulty controlling your body temperature, you start to sweat, you become very restless, can't stop moving, you may have involuntary movements, weakness. The sweating will come and go, and in between you'll have chills, nausea, vomiting, muscle aches, inability to breathe deeply, just rapid breathing, body temperature, high blood pressure, and this can last actually for a long period of time. This is one of the reasons that methadone maintenance is used, to avoid going into this withdrawal.
So how come they specifically talk about like heroin and oxycontin and Percocets that are like recreational drug users that aren't even the leading cause of death, or like and are illegal as opposed to something that's legal like cigarettes that's still 1 every 2 smokers?
So why are cigarettes legal and these other things not?
Like, why is the study that they use for recreational drugs, people who use recreational drugs and NRT, like the people who research the special drugs and find out which ones are more addictive and why they're more addictive, and they tell you about like how long it'll take it to kill the person, but like nicotine isn't involved in that. Like it's like they're against, like the pharmaceutical companies are against talking about nicotine because they don't want to lose their money selling the nicotine patches to people who are addicted to smoking. Right?
Well, I mean that's because nicotine is socially acceptable, and so is alcohol, and to some degree so is cannabis, whereas opioids and cocaine, methamphetamine aren't socially acceptable. So there's legal and illegal, there's sort of socially acceptable and not acceptable, there's all sorts of ways. And so a lot of that has just come from the history of how these drugs came to be used.
Is oxycontin and Percocets considered socially acceptable?
I mean, I don't think, I mean, it all obviously depends on your peer group, but I mean, I think that people would, if people might see an OxyContin drug abuser as not socially acceptable, whereas a smoker, although smokers these days are pretty not socially acceptable as well. Yeah.
How dangerous are those opiate withdrawal symptoms? Could the patient die of it, or is it just
they can, yeah. I mean, usually they're treated either with replacing the opioid with a long-acting version like methadone, and just general supportive measures in detox facilities or things like that. If you go into an opioid overdose and you start to see respiratory depression, you can rescue the person by administering an opioid receptor blocker called naloxone, and that will reverse the respiratory depression, but it can also actually precipitate a withdrawal symptom. So I'm just going to talk very briefly about some stimulants, and then I think maybe we'll stop for the night. So I want to talk about amphetamine, cocaine, methamphetamine, and just briefly talk about ecstasy. So this is adrenaline, or epinephrine. So if you take a look at this structure, then take a look at amphetamine and methamphetamine, ephedrine, ecstasy, you can see that they're all very, very similar. They all look a lot like adrenaline. And so that's why when you take one and you get some effects that are similar to having lots of adrenaline in the body. So your attention level goes up, you have lots of energy and so forth. So how do these drugs work? Well, they mostly work by increasing the amount of adrenaline in the body. And this is a nerve cell, and this is another nerve cell, and in between is called the synapse. This is the space in between the two nerve cells. These nerve cells are always releasing dopamine and adrenaline into the synapse. What amphetamine will do is actually cause a reversal of the uptake mechanisms for adrenaline. Usually adrenaline comes into the synapse, or dopamine comes in, and then it goes back in once its job is done, and that happens very quickly. All of these drugs will increase the amount of adrenaline into the synapse and dopamine in the synapse.
What if they hit each other on the way out, they're going back and they catch
Well,
each other? Do
these-
they explode?
no, but these, they're small enough that you can get like thousands and thousands of molecules coming in and out at the same time. What's the difference between methamphetamine and amphetamine? Has anyone watched Breaking Bad? It's a really interesting television show about that. I hope it's not me someday if my career goes down. But it's a very good, interesting show about methamphetamine and methamphetamine production. So just like we talk about heroin and morphine, methamphetamine means methylamphetamine. And putting the CH3 group here is going to make it less water soluble and more fat soluble. And so it's going to help it get into the brain faster than regular amphetamine. And if you can get something into the brain faster, you can get a more intense high and more rewarding properties from it. So that's, and then on top of that, you can ingest methamphetamine, but if you smoke it or if you inhale it, you get it into the body faster. So you get it, you smoke it, that gets it into the body faster, and you have that methyl group there that gets it into the brain faster. And that's the reason that methamphetamine is becoming, or already is a huge problem, and already is, and is getting to be a worse problem. And you can make it, if any of you watched the show, from pseudoephedrine containing products, nasal decongestants as a building block. It's not simple to make, but it's relatively simple to make.
So the methamphetamine is cocaine, but it's...
No, it's similar to cocaine, but it's a little bit different.
What do they call it? They call it is a problem for the society? Is that what you're saying?
Methamphetamine is extremely addictive, which makes it difficult to use recreationally. It makes it more difficult to use recreationally without becoming addicted to it. So it's one of the more addictive substances that are widely used, at least. Just a quick word about ecstasy. It's again similar in structure, so it's got a methyl group as well. It's got this ring that's a bit different. And this is very interesting because when you compare it to ecstasy, compare it to amphetamine, some of the effects are the same. So you get a stimulatory property, but it also has a very peculiar activity of enhancing feelings of intimacy and empathy. And it was originally used in certain psychotherapy settings as an adjunct treatment to promote feelings of intimacy. So this mechanism is a little bit unknown, how it's doing that and how it's doing that differently than regular amphetamine would be doing. I think we're going to stop now, but I wanted to just, I'm happy to answer some questions. I just want to talk about salvinorin, because this is another one that's in the news a lot. This is a magic mint component. The salvinorins are the chemical in the magic mint. This is an hallucinogen and a dissociative hallucinogen, and it's been used for centuries in South America and Central America. The major hallucinogenic ingredient is salvinorin A. They don't activate serotonin receptors like LSD does. It actually activates a certain subset of the opioid receptor as well as dopamine receptors. And the good and the bad thing about salvinorin A, I guess, is that it's got an immediate onset, or very fast onset, and it's got a very fast offset. So it's